FDA is alerting healthcare professionals about rare but serious complications associated with the surgical mesh used to treat pelvic organ prolapse and stress urinary incontinence. The mesh is usually placed transvaginally using minimally invasive techniques.
Over the past 3 years, FDA has received over 1,000 reports of complications. The most frequent included erosion of the mesh through the vaginal epithelium, infection, pain, urinary problems, and recurrence of the prolapse or the incontinence.
Treatment of the complications included IV therapy, blood transfusions, drainage of hematomas or abscesses, and additional surgical procedures, in some cases to remove the mesh.
FDA has several recommendations to help reduce the risk. First, clinicians using mesh for the treatment of pelvic organ prolapse and stress urinary incontinence should obtain specialized training for each of the mesh placement techniques and be aware of their risks. They should be vigilant for potential adverse events from the mesh, especially erosion and infection, and also from the tools used in transvaginal placement, especially bowel, bladder, and blood vessel perforations. They should inform patients about the potential for serious complications and their effect on quality of life, including scarring and pain during sexual intercourse. Patients should also be informed that implantation of surgical mesh is permanent and that some complications associated with the mesh may require additional surgery that may or may not correct the problem.